Hello and welcome to eMedicore Patients Corner series. Today's discussion is on hematuria, blood in the urine. What is hematuria? Hematuria is defined as the presence of a high number of red blood cells in the urine. There are two main types of hematuria, microscopic and gross hematuria. In microscopic hematuria, or microhematuria, the urine appears normal to the naked eye. However, under examination with a microscope, the urine has a high number of red blood cells. Microscopic hematuria is usually discovered through a urine test as part of a medical evaluation. In gross hematuria, the urine is pink, red, or dark, like the color of cola. There may be clumps or blood clots in gross hematuria. Where does the blood in the urine come from? The blood can originate anywhere along the urinary tract, including the kidneys, ureters, bladder, urethra, and the prostate in men. And the causes of hematuria, in many people, there are no specific cause actually found. However, hematuria can be a sign of a serious medical condition. It should be evaluated as soon as possible. This is a diagram of the female urinary tract. This is a diagram of the male urinary tract. The common causes of hematuria include cancer of the genitourinary tract, which is the kidneys, ureter, bladder, and prostate, enlarged prostate or benign prostatic hyperplasia, urinary stones, infection of the genitourinary tract, which are the kidneys, ureter, bladder, and prostate, renal or kidney disease, vigorous exercise or injury to the urinary tract, and bladder irritation from radiation or chemical exposure. How is hematuria diagnosed? Gross hematuria is alarming and prompts patients to seek early evaluation. Microhematuria often has no symptoms, but can be caused by a serious medical condition. Microhematuria is usually detected by a urine dipstick test. A positive dipstick test for hematuria needs to be confirmed by examination of the urine under a microscope. If there are 3 or more red blood cells per high-power field, evaluation for the cause of hematuria is recommended. What are the tests needed to evaluate hematuria? The tests needed to evaluate hematuria include a history and examination by a physician, a blood test to estimate the function of the kidneys, imaging tests including CT scans or computed tomography without and with intravenous contrast, or CT urogram, to evaluate the kidneys, ureters, and bladder. CT scans, however, cannot evaluate the lining of the bladder wall, and cystoscopy is recommended. Cystoscopy, a procedure in which a physician inserts a small telescope into the bladder to examine its lining. Urine cytology, a urine test in which the doctor looks for the presence of tumor cells under a microscope. This may be helpful in certain patients. And for patients who cannot have a CT because of a kidney disease or allergy to contrast, non-contrast CTs, MRIs or magnetic resonance imagings, or ultrasounds in combination with retrograde pyelograms may be done. What follow-up tests are needed if there is no cause of hematuria found? Patients should consider retesting and evaluation of kidney disease at certain intervals, especially if you are at an increased risk of bladder cancer. For instance, over the age of 50, a current or former cigarette smoker exposed to chemicals or radiation, or overuse of certain pain medications. If there is recurrent gross hematuria, one should immediately repeat a cystoscopy, and imaging should be considered as well. In terms of treatments for hematuria, the treatment depends on the cause of the hematuria. eMedicore, core medical education. For everyone.
From everywhere.
Forever free.